Imagine you're an elite NFL linebacker. You are in the best shape of your life. You are called for a random drug test. You take it, no problem. But a few days later, you walk into your locker room. You find an envelope marked confidential. You rip it open, you see the result. You failed. But not for steroids. You are tested positive for '8CG, the pregnancy hormone. Everyone thinks you're cheating, but one doctor knows the truth. You are not testing positive for steroids. You are not pregnant. You have testicular cancer. This isn't a medical drama. This actually happened to Alex Singleton, the Denver Broncos linebacker, just last month, November 2025. And because of that failed test, it may be the only reason he is alive today. I'm Dr. Michael Chovanec. I'm a professor of oncology, and I treat testicular cancer every single day. In this video, I'm going to explain why a man would have a positive pregnancy hormone and what 3 signs Alex Singleton might have missed that you could be missing today. So why does a 31-year-old linebacker test positive for pregnancy hormone? To understand this, you need to understand what testicular cancer really is. Testicular cancer comes from germ cells. Germ cells are designed to create life, to produce sperm. But if a germ cell turns into cancer, it gets confused. It starts pumping '8CG into the bloodstream because it thinks it's a placenta. Placenta in a pregnant woman produces '8CG, which is a pregnancy hormone, and this is completely normal. But if a young man has '8CG in the blood, this means he has cancer. Now, NFL bans '8CG because sometimes athletes use it to kick back their own testosterone production after being suppressed after the steroid cycle as a drug-enhancing protocol. The reason '8CG may be used for kicking back testosterone production is it mimics LH, which is luteinizing hormone. They actually have the same alpha subunit of their molecular structure. It looks exactly the same. So our body thinks it's getting the signal to produce more testosterone. So for the league, it's a red flag for cheating. But for oncologists, it's a huge red flag because there is a cancer in your body hidden somewhere in there. Here's the scary part. Alex felt fine. He even played full game that Thursday night against the Las Vegas Raiders. He played 60 snaps. He made tackles. He had no pain. He had no weight loss. If it wasn't for that random test, his cancer could have been silently spreading throughout his body, into his lungs, into his liver or brain, ultimately being deadly. You don't have the NFL testing you every week. You don't have a team of doctors taking care of your health all the time. But you have your hands. The good news is Alex caught it early. Testicular cancer is the single most curable cancer there is, and that's because we have cisplatin. Cisplatin is chemotherapy, and after the course of chemotherapy, the tumor basically melts away. This therapy isn't just luck. It was pioneered by my mentor, Dr. Lawrence Einhorn at Indiana University. Before his work, this cancer had a 90% death rate. Today, because of his protocol, it has 90% cure rate, and we are able to save more than 90% of patients with metastatic disease. This is a success story of modern oncology. But the easiest way to cure this is to catch it early while it's still only in the testicle. Alex Singleton was back in the field less than a month after they found it, because they found it early. He even trailed the league with a 1-ball celebration, and they didn't dare find him. So here's the homework for you. Tonight in a shower, try to feel for any bump, changing side, any painful signs, anything that you feel unnatural or shouldn't be there. And if you are unsure, take the ultrasound. It is the only way how to rule out cancer. It is safe, it is quick, and it is pain-free. The rule of thumb is to check yourself every single month. Let me know in the comments below if you checked yourself today or if you are checking yourself already regularly. That would be a great inspiration. And please do not die of embarrassment. If you like this content, please like and subscribe. My name is Dr. Michael Chovanec, and I'll see you in my next video.